name is Bárbara Vallespin. I'm the manager of the mHealth Competence Center here at Mobile World Capital. Mobile World Capital is a public foundation. It is basically devoted to the promotion of mobile technologies in different sectors. And the sector where I'm focused is basically mHealth. It's everything that has to deal with mobile technologies applied to healthcare. We are moving from the traditional system to the future system. That means basically that the patient is going to have a much more active role in what regards to the management of their own health. And in that sense, we have to provide tools for the citizen to be able to manage their condition. One of the major challenges that all the cities, all the countries are facing are how to take care of the elderly, and also because those people are the ones who are suffering from chronic disorders. And as you know, chronic disorders are about 70% of the healthcare cost are going to cover chronic disorders. So in that sense, we believe it is very important somehow to include the elderly and to provide support and to help them with those technologies. Adapted technologies, that is very important. Elderly people cannot interact and cannot use the same technologies as young people for obvious reasons. So there is an important important work that has to be done so that we can adapt technologies, we can adapt tools to those people and the way they can interact with the system. I think it's a very interesting project, basically because it tackles one of our main objectives within the mHealth Competence Center, that is basically to avoid isolation of citizens, isolation of patients, and we find very interesting to start to develop technologies that deal with this and try to include all the citizens independently of their situation or their condition. That we are a little bit still far away to have it fully deployed within our society for obvious reasons. The first one is because it has to be tested, it has to be pilot on a large scale base. The second thing, which is very important to take into account, is the security issue. So specifically when we are talking about healthcare and when we are talking about accessibility to healthcare data, this is one of the major items that we have to take into account.